Every day, 360 people in the United States begin dialysis for the first time. By the time this video ends, another 5 will have learned that their kidneys have failed. And for some of them, the cause was never their age. It was a bottle sitting on the bathroom shelf, one they had been taking for years without a single reason to question it. Someone who felt perfectly healthy. No symptoms, no warning signs, nothing out of the ordinary until the blood test came back and the numbers told a different story. And everyone around them said, well, these things happen as you get older. Sometimes they don't just happen, sometimes they are caused by medication, prescribed by a doctor, filled by a pharmacy, taken exactly as directed. Today, we are going through 9 of the most commonly taken medications with documented links to kidney damage, counting down from the ones most people never suspect to the one I consider the most dangerous of all. Watch for number 1. It is taken by more people than almost any other medication in the world. Most of them have never once considered what it might be doing to their kidneys. It may surprise you, and it may already be in your medicine cabinet. Before we start, tell me in the comments which medications you take every day. I read every single one.
Kidneys can also be damaged by medications. There are some medicines that are nephrotoxic. That's a fancy word that means toxic to the kidneys, the nephrons. That's a big unit of which the glomerulus, the filter, is part of it.
Your kidneys work every hour of every day without you ever asking them to. They filter your blood, remove waste, regulate your blood pressure, and keep the right balance of everything your cells need to function. 2 organs, roughly the size of your fist, doing some of the most important work in your body, silently, continuously, for your entire life. What most people don't realize is how sensitive they are to the chemicals passing through them. And medications, even ones that have been prescribed for completely unrelated reasons, pass through the kidneys at high concentration every single time you take them. For some medications, that is not a problem. For the 9 we are going through today, it can be. How medications damage kidneys. Before the countdown, a quick picture of what damage actually looks like inside the kidney, because understanding this makes everything that follows make sense. Dr. Jason Fung is a nephrologist, a kidney disease specialist, who has one of the clearest explanations I have come across.
Think of it this way. The kidney is sort of like a sieve. Imagine you're washing blueberries in the sink. The blueberries go in the sieve, you pour in the water, that holds all the blueberries in, and the water goes out. If you start to see blueberries in the sink, well, there's nothing wrong with the blueberries, but it means you have a hole in your sieve. Same thing with the kidneys. The kidneys are supposed to keep all of that protein inside and let all the urine flow out. If you start to see protein in the urine, it's not that you're eating too much or too little protein or the wrong protein. It means that there's little tiny holes in the kidney that really shouldn't be there.
That is what the medications on this list can do, quietly, over time, without a single warning sign. Now, here is the countdown. Number 9, and this one should not be underestimated just because it comes first. It is almost certainly in your home right now. NSAIDs, ibuprofen, sold as Advil and Motrin, and naproxen, sold as Aleve. Most of us reach for one of these without thinking twice, for joint pain, backache, headaches, or inflammation. Taken occasionally by someone in good health, the risk is low. But something changes after 50, and the research is very clear about what it is. Your kidneys have blood vessels that need to stay open and flowing to do their job. NSAIDs interfere with the chemicals that keep those vessels open. Take them regularly, and the blood supply to the kidneys gets restricted. The kidneys have to work harder with less to work with. In someone who is older or dehydrated or already managing blood pressure issues, that restriction can tip into real damage. A study in the American Journal of Kidney Diseases found that regular NSAID use raised the risk of acute kidney injury by 58% in adults over 65. And the most dangerous part? There is usually nothing to feel until the damage has already built. A woman in her late 60s managing arthritis took ibuprofen most days. Nobody mentioned that at her age, with her blood pressure, those tablets were stressing her kidneys every time. She found out when a routine blood test showed her kidney function had dropped by a third. She had felt completely normal. Ask your doctor, given my age and kidney function, is it safe for me to take this regularly? And is there a gentler alternative for my pain? That is number 9. Number 8 is one that millions of people have taken for years, and very few of them have any idea it is affecting their kidneys. Number 8. Proton pump inhibitors. Prilosec, Nexium, Protonix. These are taken for heartburn, acid reflux, and stomach ulcers, and over 15 million Americans take one every single day. Many people assume they are harmless because they are available without a prescription. That assumption is worth examining. Proton pump inhibitors dramatically reduce stomach acid, and it turns out the kidneys depend on nutrients. That stomach acid helps absorb nutrients that gradually drop when the acid is gone for long enough. Some proton pump inhibitors also appear to trigger a slow-burning inflammation in the kidney's filtering system that can reduce function over time without the person feeling anything at all. A 2016 study in JAMA Internal Medicine followed over 170,000 patients. People taking proton pump inhibitors had between 20 and 50% higher risk of developing chronic kidney disease. A follow-up study found the longer you take them, the worse the risk becomes. The most common thing people say when they hear this is, "I have been on Prilosec for 12 years and never had a problem." That is exactly the danger. The damage does not announce itself, it builds in the background, and by the time it shows on a blood test, kidney function has often already declined. These medications were designed for short-term use, typically 8 weeks. Many people have been on them for years. The conversation worth having with your doctor: how long have I been on this? Do I still need it at this dose? And can we look at tapering or stopping it safely? That is number 8. Number 7 is prescribed to protect the heart, but it asks a lot of the kidneys to do it. Number 7. Diuretics, water pills. Lasix, HCTZ. Prescribed for high blood pressure, heart failure, fluid retention. They work by telling the kidneys to push out more fluid, and that is exactly their purpose. The problem is what happens when the body does not replace what goes out. When fluid drops because the weather is hot, because you are unwell, because you simply did not drink enough, blood volume drops. When blood volume drops, the pressure supplying the kidneys drops with it, and kidneys running low on blood flow start to struggle. This can happen surprisingly quickly, especially in summer. The risk increases significantly when diuretics are taken alongside NSAIDs. Both reduce kidney blood flow, and taking them together pushes in the same harmful direction at the same time. A woman on Lasix for heart failure has a hot day in July. She drinks a little less than usual. By evening, her kidneys are already under stress. This is one of the most common reasons older adults end up in the emergency room, and most of them had no idea their water pill was part of the reason. What to bring up at your next appointment? How much fluid should I be drinking daily on this medication? What are the warning signs of dehydration? And what should I do if I get sick and cannot keep fluids down? That is number 7. Number 6 is completely different from everything else on this list because you don't take it at home. It is given to you inside a hospital. Number 6, and this one catches people off guard because it is administered in a medical setting, which is exactly why nobody thinks to question it: contrast dye. If you have ever had a CT scan with contrast, a cardiac catheterization, or a coronary angiogram, you have had this substance injected into your bloodstream. It makes blood vessels and organs visible on imaging. For most people under 60 with healthy kidneys, it clears without issue. For adults over 65, especially those managing diabetes, blood pressure, or any kidney concerns, it can be toxic to the cells inside the kidney's filters. And the damage often shows up days or even weeks after the procedure, long after anyone has thought to connect it. Studies suggest this type of injury occurs in roughly 1 in 10 people who fall into the higher risk category. A man in his early 70s goes in for a routine cardiac CT scan. His kidney function is never checked beforehand. 2 weeks later, his blood test comes back abnormal. The contrast dye had triggered damage that built silently for days. He never connected the scan to the result. His nephrologist did. Before any imaging procedure involving contrast, be direct with your medical team. Please check my kidney function before administering the dye. Is contrast strictly necessary for this scan? And what precautions should be taken given my age? If you are over 60 and have never had a kidney function test, ask for one before your next procedure. That is number 6. Number 5. Most antibiotics are completely fine, but several of the most widely used ones carry a kidney risk that most patients are never told about. Number 5. Not all antibiotics harm the kidneys, but a handful of the most powerful ones, particularly those used in hospitals for serious infections, can cause direct kidney damage. Gentamicin and tobramycin are highly effective against dangerous bacterial infections. They are also among the most kidney-toxic medications in use. They work by targeting bacteria, but in doing so, they accumulate inside the kidney's own filtering cells and cause damage from within. Between 10 and 25% of patients who receive these antibiotics experience some degree of kidney injury. Vancomycin, used for resistant infections like MRSA, carries a similar risk. And Bactrim, widely prescribed for urinary tract infections, which are extremely common in women over 60, can interfere with how the kidneys work and, in some cases, cause direct harm. A woman in her 60s with recurring urinary tract infections takes Bactrim 3 or 4 times a year. Nobody mentions that her kidneys are processing this repeatedly, or that the cumulative effect, combined with mild dehydration, may be slowly raising her creatinine each time. For most people, a short course of antibiotics carries low-lasting risk. The risk rises with longer or repeated courses, and in people who already have reduced kidney function. If antibiotics are prescribed, ask whether there is a kidney-friendlier option for your specific infection and whether your kidney function should be monitored during the course. Quick pause. If this video is connecting dots you have never connected before, drop a like. It takes 1 second and it helps this video reach the people who need it most. And while you are here, please tell me in the comments if you are taking any of the medications we have covered so far. We are halfway through the list, and the second half is where the real surprises begin. Number 4. A medication taken for a condition that has nothing to do with the kidneys, and one of the most significant on this list, for long-term kidney health. Lithium is prescribed for bipolar disorder and is genuinely life-changing for many of the people who take it. The kidneys eliminate almost all of it from the body. And unlike most medications that pass through without lasting effect, lithium can accumulate in kidney tissue over years of continuous use. 2 things can happen. First, the kidneys can lose the ability to control water properly, causing constant thirst and frequent urination that many people experience but never connect to their medication. Second, over the longer term, the kidney's filtering tissue can become inflamed and slowly scarred. Research published in the British Medical Journal found that between 10 and 20% of long-term lithium users develop chronic kidney disease significantly higher than in the general population. This does not mean lithium should be stopped. For many people, it is the medication that keeps them well. What this means is that if you take lithium, your kidney function should be checked at least every 6 months, and both your prescribing psychiatrist and your regular doctor should be part of that conversation. The tragedy is that many patients on lithium for years have never been told to watch for early signs: unusual thirst, needing to urinate more than usual, and fatigue simply because nobody connected those symptoms to the medication. The essential question for anyone on long-term lithium should be, when was my kidney function last tested? How often is it being monitored? And what is my current GFR reading? That is number 4, and number 3 will genuinely surprise almost everyone because it sounds like the gentlest, most harmless thing on this list. Number 3, which is the one medication almost nobody expects to find on a kidney damage list: sodium phosphate laxatives, fleet enema, oral sodium phosphate bowel preparations, the kind given before colonoscopies. In 2008, the FDA issued a black box warning, the most serious warning it can give, for oral sodium phosphate preparations. The reason was a condition where phosphate crystals form directly inside the kidney's filtering tubes, causing inflammation and permanent scarring. Here is how it happens. These preparations push a large amount of phosphate into the body very quickly. If the kidneys cannot process that load fast enough, which is more likely in older adults, or in people who are even mildly dehydrated before the procedure, or those with any existing kidney issues, those crystals form. The damage often appears weeks after the procedure. By then, nobody has thought to connect it. The colonoscopy is supposed to be the responsible health choice. People come in for a screening that could save their life and leave with kidney damage from the preparation nobody warned them about. Weeks later, feeling off and tired, they have no idea why. This does not mean avoiding colonoscopies. They save lives. It means asking whether a different bowel preparation is available. Before your next colonoscopy, ask whether there is a bowel preparation available that does not contain sodium phosphate, and whether your kidney function should be checked before the procedure. That is number 3. Number 2 is for people in some of the most difficult medical situations, and the kidney risk is one of the most serious on this entire list. Number 2 is a medication prescribed to save lives and carries one of the more significant kidney costs on this list. Calcineurin inhibitors, cyclosporin, sold as Sandimmune and Neorol, and tacrolimus, sold as Prograf. These are prescribed for organ transplant recipients to prevent the immune system from rejecting the new organ, and for certain autoimmune conditions. In many cases, they are the difference between life and serious illness, and nothing in this section is a reason to stop taking them. But here is what they do. They work partly by tightening the blood vessel that delivers blood to each of the kidney's filters. Less blood supply means less filtration. Over months and years, the filters start to scar. Healthy kidney tissue slowly gets replaced by tissue that cannot do the work. For someone who has received a kidney transplant, this creates one of medicine's most painful ironies. The medication that protects the new kidney from rejection can, over time, damage the very organ it was meant to save. If you take either of these medications, regular kidney monitoring should already be in place. If it is not, or if you have not discussed your kidney function with your doctor recently, that conversation needs to happen now. If you take either of these medications, your kidney function should already be monitored regularly. Ask when it was last checked, what your current GFR reading is, and whether your dose is at the lowest effective level. And that brings us to number 1, the medication on this list that will surprise almost everyone, because it is the one medication that nobody questions. And number 1, not the most toxic on this list, but in many ways the most important, because it is the one nobody suspects, acetaminophen, sold as Tylenol in the United States and known as paracetamol elsewhere. For decades, it was considered the safe alternative, particularly for people told to avoid ibuprofen because of their heart or stomach. And for occasional use at normal doses, the kidney risk is genuinely low. Here is where the concern lies. The liver breaks acetaminophen down into several byproducts. One of them has to be processed by the innermost tissue of the kidney. With daily high-dose use, over months or years, that byproduct accumulates and causes slow, silent erosion of kidney function. A large study in the Archives of Internal Medicine found that women who took acetaminophen daily or near daily over a long period had a significantly higher risk of chronic kidney disease. A woman in her early 70s with chronic joint pain had taken 2 Tylenols every morning for 8 years. Her doctor told her to use Tylenol instead of ibuprofen because of her heart. She did exactly what she was told. What nobody mentioned was that daily long-term use at that level was steadily asking her kidneys to process something they were not fully clearing. Her kidney function had been declining for years. She had felt completely fine. The question worth raising with your doctor: given how regularly I take this for pain management, should my kidney function be monitored? And is there a better long-term option for my specific situation? Before we get to the action steps, this is the most important thing in this video. Never stop or change any medication without speaking to your doctor first. Every medication on this list was prescribed for a reason. In many cases, the benefit outweighs the risk, especially if you are already managing a serious condition. The goal of this video is not to frighten you. It is to give you the questions that very few people ever think to ask. Because the conversation that rarely happens is the one that could make the biggest difference. Ask, what is my current kidney function? When was it last tested? Does my medication history put me at higher risk? Those 3 questions at your next appointment could be among the most valuable health conversations you have this year. Here are 3 things you can do, starting today. First, get your kidney function tested. Ask your doctor for a creatinine and GFR test. Your GFR is simply a measure of how well your kidneys are filtering. It is a routine blood test. It doesn't cost much, and it tells you exactly where you stand. If you are over 60, or if you take any medication on this list, and this test has not been done in the past year, ask for it. Here is what makes this worth doing now, rather than later. Dr. Jason Fung, the kidney specialist you heard from earlier, puts the timing in perspective.
This whole process takes a long time, from the development of type 2 diabetes to microalbuminuria to proteinuria to kidney disease to dialysis. Each stage takes approximately 5 years or so. So there's plenty of time, if you detect it, to intervene.
Second, drink more water. Dehydration amplifies the risk of every medication on this list. 6 to 8 glasses a day is a reasonable baseline, more in hot weather, more when you are active, and especially more if you take a diuretic. Third, bring your full medication list to your next appointment. Everything, prescription, and over-the-counter. Ask whether any of it is known to affect kidney function. Ask whether anything on the list interacts in a way that increases the risk. Few people have ever had that conversation. It takes 5 minutes. Our next video covers the foods that research suggests can support kidney health naturally. If you want to know what they are, subscribe and turn on notifications so you don't miss it. If today's video was useful to you, share it with someone you care about. Tell me in the comments, are you taking any of the medications on this list? And when did your doctor last check your kidney function? Your answers shape what this channel covers next. Your kidneys have been working for you every minute of every day for your entire life. Now you know how to look after them. Talk to your doctor, get your levels checked, ask the questions, because knowing is the first step and you just took it. This video is for educational purposes only and is not medical advice. Never stop, reduce, or change any medication without speaking to your doctor first. If you have concerns about your kidney health or any medication you are taking, please consult your physician or a qualified healthcare provider. This channel is independently produced and is not affiliated with or endorsed by any of the experts or institutions mentioned. Until next time, nourish yourself well.